Um, Good afternoon, everyone. Welcome to Module 12D. In our previous module, we've been discussing something very important about safety, prevention of injuries, prevention of illness. Now, today, we'll be talking about what to do when injuries and emergency happens. We've talked a lot about diseases and emergencies and how these things can happen. Now, let's know what to do. I think I mentioned before that the goal of knowing problems is not just to know the problems alone, but to know how to solve the problems. The reason why we've been able to understand the types of injuries, the type of cuts, type of choking, and everything that we just discussed in previous modules is what to know what to do when this thing happens. So now we are discussing practically what to do when injuries and emergency happens. What to do when injuries and emergency happen. So without wasting much time, we'll move to the next subtopic, which is the first part of the introduction. While home health aides or personal care aides work to keep their patients in their home safe, there are situations where accidents may occur. Now, it is important that the home health aides or personal care aides are aware of their agency's policy regarding incidents. Every agency has their own policy on how incidences are being handled. So most agencies will have provided them with training in how to deal with emergency situations. And this will include the agency's policies and procedures and an emergency contact list. So if a home health aide or personal care aide must with emergencies, whenever in doubt, you can call a supervisor. Now, what are the first aid for common injuries? We'll be talking about so many injuries like bruises, like sprain, like burns, like chemicals, splash, like a lot of other things there. So let's move on to the first thing. First aid techniques for falls. And when the patient falls, what do you do? Now, first aid is the first treatment given to an injured person before being taken to the hospital. So what are the first aid techniques for falls? Now, if a patient falls, it is important to immediately assess them for home health aides or personal care aides to inform their supervisor. Now, we know that as home health aides or personal care aides, it is our duty to inform our supervisor when our patient falls. So, if they are trained to do vitals, they can take vital signs as maybe blood pressure. So they should also do so. Now, check if the patient has hit his or her head on the floor. Then you never move someone who appears to have hit their head or maybe to have a major back injury. This could even do more damage to them. You check for cuts, you check for bleedings, or any obvious injuries. And if there's an injury, try to determine the extent of the injury. Then you report any observations made to a supervisor or to the EMS. So you report any observation made to supervisor or to EMS if there is if there's any emergency. Now, if there is bleeding, you can put on gloves and apply pressure to the wound with a clean and dry towel. Note how long it takes for blood to saturate, that's to fill the towel, and report this to supervisor and or to the EMS, emergency medical services. So if there is a need for additional towel, you can place another clean towel on top of the current one. Do not let up pressure on the bleed. Always
Sorry for the interruption. A call.
Accepted. So what I was saying, this one, this one. Now, if there is bleeding, put on gloves and apply pressure to the wound in a clean and dry towel. So, if the blood saturates the towel, you can add another, but never let it up pressure on the bleed. Then never leave a patient alone who has fallen. Stay with the patient until additional help arrives. Document all the injuries and the steps taken to provide the care you are going to render to the patient. Uh, First aid for bruise, or first technique for bruises. A bruise forms when blood vessels below the skin surface break and blood leaks into the tissue beneath the skin. The bruise can range from a very small to quite large, covering a large area of the body. And remember this acronym, RICE, that's RICE, when treating bruises. The first is rest. You encourage the patient to rest and what? Immobilize the affected area. Rest that affected area to prevent further injury and to allow it to heal up. Then number two, which is eyes. If the patient is not broken, help him as a home health aid or personal care aid should apply what? A cool cloth or an ice pack wrapped in towel to protect the patient's skin to the area for about 20 minutes. And this can be repeated several times a day as directed by the care plan. Remember to never apply ice directly on the skin as this can cause injury to the skin itself. Do not use heat, and we encourage the patient to avoid hot showers and bathe for the first 48 hours after that injury. So these are first for bruises, an example. Then C, compression. We talked about rise. We said rest, eyes, now compression. Compression means that you wrap an area of the injury with an ice bandage, so AC bandage. If directed by the care plan or by your supervisor, compression helps to relieve swelling and pain. So remember not to wrap the area too tightly, as this could cause further injury. Then E, elevate. Elevate the bruise above the level of the person's heart if possible, because this will help to decrease swelling. So I mentioned again RICE, rest, eyes, compression, and what? Elevation. So we are moving to the next point, to what? Seek further guidance from a supervisor. Remember to inform him or her of any injury a patient has sustained. And mind you, document injuries, and all the steps you're taking to provide the care for the injury. So if the bruise covers a large area of the body and appears to be maybe serious or it could be very serious, that the skin has broken down or the patient is bleeding, bleeding a lot, you activate emergency services, call 911, call for ambulance as emergency. Calmly inform the emergency. Oh, kindly inform the EMS of the decision and the observation made too. Then it is also important to inform EMS if the patient is on any anticoagulants. And what are anticoagulants? Anticoagulants cause blood to take a longer time to clot. So if a patient is on anticoagulants and they get a cut or they get injured, it takes a longer time for the blood to clot. So the blood keeps on bleeding for a longer period of time. So this will help in a longer, this results in a longer bleed time and could potentially life-threatening to the patient. So inform 911 or the EMS or the emergency services of if the patient is on any blood thinners. Now, first aid techniques for cuts and scrapes. First aid techniques for cuts and scrapes or scrapes. For minor cuts and scrapes, basic first aid at home may be adequate. Home health aides or personal care aides should also inform the supervisor of the institution, and seek guidance from them in caring for the wound. Always wash hands and apply gloves when performing first aid. Now, what are the basic first aid for caring for cuts and scabs? This includes what? First, washing the area with a but do not use soap. Once the area is clean and the blood has decreased, place gentle pressure on the wound with a clean and sterile gauze pad. And when the wound has stopped bleeding, dress the area with a clean bandage. Document all injuries and steps taken to provide the care. Notice we mentioned document. Document is not an important part of our duties. If you don't document, you have done nothing. No matter what you've done, there's no evidence that you've done it. And you don't document what you did not do. That is malpractice. So this is an example of scraps and bruises, or cuts rather, cuts and scraps. So first aid techniques for dizziness or fainting. For a patient experiencing dizziness or fainting, the first thing to do is to the patient reports that they feel dizzy. Immediately you lower them to a seated or lying down position. Remember to always allow a patient time to sit on the edge of the bed or a chair and dangle their legs before rising to a standing position. This will help prevent falls from feeling lightheaded or dizzy. And if the patient is standing or walking, and they report that they feel faint, home health aid or personal care aides should lower them to a chair or to the ground if the chair or bed is not nearby. And if possible, home health aid or personal care aides can wrap their arms around the patient's waist securely using good body mechanics. Lower them to the floor. They allow having their head hit, avoid having their head hit the ground or nearby object when you are putting them on the ground. While lowering the patient to the floor, keep a wide stance to provide a strong base of support and bend using the knees to slowly and carefully lower the patient to the floor. Document all injuries and instances when patients report dizziness or faintness and the steps taken to provide care. So you document from when the patient, from the last time that the patient said he's feeling dizzy or fainting, to everything you do for the patient is what you document to care. Now, first aid techniques for burn. I know what burn is. Now, burn means what? Damage of skin tissue due to what? Maybe hot properties like maybe fire or corrosive chemicals or anything. So the treatment of burns depend on the type of burn. Now, let's look at treating minor burns. For minor burns, the first step in providing first aid to a patient who has suffered a burn is to remove them from the source of the heat. Take them away from the source of the heat. Then for the first and second degree burns that are, now we have 3-degree burns, first degree, second degree, and third degree. For the first and second degree burns that are limited to a small area, apply a clean, cool towel to clothes or close to the area of the burn for about 15 minutes to help decrease pain. Do not use ice as this could even cause frostbite. Now, once the pain from the burn has subsided, allow the area to dry for a few minutes and then apply a clean and dry sterile piece of gauze to the area. Shape the edges down. Never apply ointment or grease to any area of the burn. Do not use margarine butter or oil on the burn. First of all, the picture represented there. So a supervisor should be informed and the patient should be examined with further treatment provided if necessary. And while the burn is healing up over the next 2 days, keep the area clean and dry. Apply clean dressing to the area as directed by the care plan. If blisters form, do not break them. Allow blisters to heal naturally until the skin is healed. Avoid using lotion, using soaps or perfume directly on that area, as this could cause irritation. Now, that's for treating what minor injuries like the first and second degree. Now look about the third degree or large burns. For third-degree burns, you remove the person from the source of heat, as we know, you take the person from the source of the injury. Then, what do? We ensure that the airway is kept open and what? They continue to breathe. If they stop breathing or they can no longer feel the pulse, home health is the personal care aid to perform CPR immediately if they are trained in CPR. Now, CPR is it's called cardiopulmonary resuscitation. Here you place your hand on the patient's chest and try to help the heart to pump. So you stay with the patient at all times. Then you keep the patient calm and call 911 immediately. And do not remove clothing that is stuck on the person as you risk tearing the skin off with the clothing. To keep the area of the burn clean, cover with a clean bandage or sheet until help arrives. Do not put pressure on the burn and do not rub it. If you rub it, it will peel up. If pressure, it will also what? Peel up. It will get worse. So to prevent shock, if a serious burn has occurred, keep the person warm and lie them flat. What is shock? Shock means that the brain has been deprived of what? Of necessary oxygen. These are what? Reduced blood volume or blood pressure, so that the blood side that is coming to the head or to the tissues, the body tissues are not really effective enough to sustain the body. So patient begins to run into shock. Now we know that burn, patient lose fluid, especially a lot, like lose a lot of fluids. So what do? You keep them warm and lie them flat. Then if they have not suffered from head injury or neck injury or back injury, elevate their feet and stay with them until help arrives. Then do not immerse the person in water, as this person going through really severe shock. The highest you can do is to provide one for them and make them lie flat on the ground, and you can elevate their leg. So how do we treat chemical burn? What if the burn is not fire? Fine, it's a third-degree burn, but not a fire burn, or this burn is generally a chemical burn. The first thing we do is what? If the patient is exposed to a chemical, remove the chemical from their skin immediately and activate CMS by calling 911. They flush their skin with cool water for like 20 minutes. After that, you close, you remove the clothes that are came in contact with the chemical. So if their clothes are come in contact with the chemical, you remove the affected clothing. So if you are treating patients with electrical burns, what do we do? Now in this case of electrical burns, special precautions must be made. Never to touch a person who has been electrocuted with bare hands. Now 911 should be called immediately, and the appliance should be unplugged if it can be done safely. Do not use anything metal or waste to remove electric source. If possible, switch them off the main power supply. Now, if the appliance is standing in water, please do not touch it. Never stand in any water, even if it's a small body, while touching an electric appliance. As we know, water is a very mad conductor, and it's a good conductor. It's a very strong conductor. So a little water and electricity, that is a lot. It sends to the current around the person's body. So never you step on water, leave your hand wet, touch any electric appliance. Remember, home health is the personal care aid should report any burn to their supervisor. The patient needs to be examined and further treatment provided. So always call 911 for any serious burn. The burn that occurs on the large area of the body or on the neck or the hand or the feet on the face. If smoke has been revealed, the person is having trouble breathing after a burn, or if an infant or child or a very elderly person has suffered from a burn, home health and personal care aid should also call for help if the burn was caused by chemicals or electricity. So document all injuries and steps. So you document all the injuries and all the steps that you've taken towards provide the care for the patient. The next thing we are discussing now is the first aid for choking. First aid technique for choking. Now, what is choking? You know what choking means when you put the stuff in the throat. That's called choking. So if a patient is choking and unable to breathe, cough, or speak, home health aid or personal care aides must take immediate action by calling us 911. The permanent brain damage will occur in a little or 4 times minutes if the person is unable to breathe. Because if the brain is deprived of oxygen for a long time, it begins to what? To die. It begins to what? The cell begins to go, begins to damage. So we try to encourage them to cough or remove the object or the food and stay with them at all times while you are waiting for help. So you can use your senses of observation to determine the cause and the extent of the choking. Then, did the person swallow an object or did the choking happen while they were eating, drinking, or taking any other medicine? So you know it's different when they intentionally swallow an object or when they do it subconsciously. Then, uh, did the person swallow an object like we said? Secondly, are they able to breathe? They can't breathe. Or yeah, they can like are they able to breathe at all? They can breathe a little bit. Are they turning blue? That's cyanosis. When someone has cyanosis, it means the situation of the skin is turning blue and clammy because of why there's no oxygen saturation. So, or do you hear soft or high pitched sounds when they're trying to breathe, like all those sound, high and low sound? They are unable to make any sound or cry. Are they unable to make any sound or cry? Then are they unable to cough or is the cough weak and ineffective? Now, said, are they able to cough or the cough is weak and ineffective? It is not working. So this is an example of someone that is choking. So there are many ways we can use to help them. There's one called the Heimlich maneuver. Heimlich maneuver. Now, Heimlich maneuver is, if needed, home health aid home health aid or personal care aid must be prepared to perform abdominal thrust to help dislodge the object from the patient's airway. And this method is called the Heimlich maneuver. Remember to only do this if the person cannot breathe, cough, or speak, as if they need help. And if they are choking prior to performing abdominal thrust. And performing the abdominal thrust, that's the Heimlich maneuver for a person who is standing or seated, is standing first. You stand behind the person and wrap your hand around their waist. Then you make a fist with one hand and place your thumb against the person's abdomen. Now, how is it done? You can browse it online to see a video of it to understand it better. So you place your thumb against the person's abdomen and just above the belly button. Then with the other hand, you can grab the fist that is against their abdomen and will strictly and forcefully thrust both hands up towards you. And you thrust it up towards you. So you'll be thrusting inward and upward. This helps to move the object out of the person's airway. Repeat this until the object comes out, until the object becomes dislodged. If the person loses consciousness, you can also stop it. If the person loses consciousness, lower them to the floor and begin CPR if you are trying to do so. And keep the person in line position so that their head is facing up and ensure that their airway is not blocked. Now, performing the Heimlich maneuver for a person who is in a lying position. So if the person is lying now is beginning to choke, what do? We straddle them facing their head. How? You grasp your feet as if you would, if they stand or you're standing, then you push towards and inwards to help dislodge the object. So ensure their airway remains free and they are in a free face-up position. Performing abdominal thrust on an infant is a different process. You lay the infant face on your forehead, down on your forehead, across your lap or your thigh. Then provide support to his or her head and neck by placing you sorry, by placing your hand under the chin to hold it steady. Now, the baby head should be facing downward and than their lower body. So this helps to move gravity so that the baby can be removed. And using the bottom palm of your other hand, provide 5 blows to the baby's back between the shoulder blades. So, like something like you hit the back to get. So if the object becomes dislodged, you can stop. If the object is too stuck, turn the baby to face side up. Provide support to his neck and back to his or her back with your forearm, resting the baby on your lap or thigh. Then you provide the chest thrust by using 2 fingers in the center of their breastbone and quickly press down, compressing their chest about one third of to the I don't know. Let me get this well so I can explain better. So provide like 5 chest thrusts. We have on the part that I said you put the baby's face down, then back, you hold, you tie the baby, then you make the head go lower than the body, and you thrust the back like 5 times. So if it doesn't come out, then you can face the baby to make the baby face up. So you now provide 5 chest thrusts. So you support the baby first with your forearms, resting the baby on your lap or your thigh. Then you can now provide like 5 chest thrusts by using 2 fingers in each center of their breastbone and quickly press down, compressing their chest about 1/3 to the maybe a whole number and half to the depth of their chest, like a reasonable amount of base. You can just calculate that in the brain. So you can repeat this process until the infant expels the object or lose the consciousness. So remember that 5 back thrusts with the baby face down and 5 chest thrusts with baby face up. So 5 back up, that's back thrust, then 5 chest up, the chest position up, that was chest thrust. To document all the instances of choking and steps taken to provide care. So the supervisor should always be informed about any instances of choking. Now, quickly, I'm going to the first aid techniques for poisoning. What if a patient gets poisoned? What do you do? So if a home health aid or personal care aid suspect or know that poisoning has occurred, they should try to determine the source of poisoning. First, determine the source of the poison. Now, it's important that this will help to provide what the poison control information they need now to help them to help you best. Look for nearby medications like chemicals and fluid solutions that the patient may have ingested. Then immediately call poison control and follow the direction. The treatment for poison depends on the type of poison that was ingested. Notify a supervisor as soon as possible. Then never try to make a patient vomit. Never try to make a patient vomit unless specifically you are instructed to do so. Some chemicals may be corrosive, they may be harm. So when they come back up, they can corrode. So when you look at patient's mouth normally and see that the mouth is not specified, you can see that the poison may not be corrosive, but then some corrosive that when they touch the lips or touch the esophagus and everything, you see that it causes severe harm if they come back up to esophagus. So document all the poisoning and all the steps you are taking to provide care for the patient. What to do in a serious medical condition? Now, what are serious medical conditions? This is just categorizing a lot of conditions together. So should a serious medical condition occur like an emergency, home health aides or personal care aides should assess the situation using their observational senses. Note that what was seen, what you heard, what you felt, and what you smelled, and maybe call 911 for help. That's emergency. So activate emergency medical services by dialing 911, then inform them in a calm and I repeat this point. Inform them in a calm and matter of fact way that occurred and the observations made. So you inform them in a calm manner what happened and what are the adjustments you've made so far. Then never leave the victims unattended to. Keep in mind the ABCs of first aid, the A serving as the airway, the B serving as the breathing, and the C serving as what? The circulation. It's important to remember that this acronym is very, very, very important. And at any delay in treatment, when the patient has a compromised airway, breathing or circulation, could result in a serious injury and even death, possibly death. So how do we assess the ABCs? The first one we are assessing is the airway. Now, how do we assess the airway? If your patient's airway or the mouth, or that your mouth or your nose is open, is there an obstruction which makes it possible for them to breathe? Then if there is an obstruction and the person is unable to breathe, activate the what? Emergency medical services and perform the what? The Heimlich maneuver to try to remove the obstruction. Now let's consider the assessing the ABCs, the B part of which is breathing. If the person breathing, is the person breathing? That's the first question. Is he still breathing? Is he alive? If he's not breathing, that means he's no longer alive. So is the person breathing? Can you feel the chest rise and fall as they breathe? Then can you feel air move in and out of their mouth or nose? Then if the answer is no to any of these questions, home health aides or personal care aides should activate EMS and begin CPR if immediately. Then the final one is to see the circulation. Do they have a pulse? How is their color? Are they blue? Is there lack of oxygen? Does their skin feel cold? Does their skin still feel warm, rather, to touch or to cold? Then cold skin means not enough blood is pumping through the body, and the person does not have pulse. Home health aides should home health aides sorry. So could does their skin feel warm to touch or cold? I've said that already. And cold skin means that they don't have enough blood pumping to their body, and if the patient does not have a pulse, home health aid or personal care aid should activate EMS and perform CPR if they are to do so. So take note of the services any of the ABCs are compromised, then report observation to the National Medical Services. Stay with the patient. If trained to perform CPR, we perform what? CPR. That's cardiopulmonary resuscitation. Let's consider some severe or serious medical conditions and how to deal or to go about them as home health aid. Consider about cardiac infarction, that is heart attack. Now, heart attack is that the heart attack, the most of the heart attack, the blood supply has been cut short or reduced, and as a result, the heart is suffering from what? Ischemia or ischemic problems. From there, the heart begins to work over labor, or a lot of things happen and the heart stop. That heart attack. It's just for a period of time. So malformation is not a heart attack, and it's the same way the heart loses adequate function of what of adequate oxygen supply. So malformation is a medical emergency and helps. It must be what obtained immediately. Help must be obtained immediately. So what are the signs you see in the patient heart attack? You see that the chest is paining the patient, the pain radiates and extends to the jaws, to the arms, to the back. It also causes nausea and vomiting. Then the intense chest pressure also increases, like feeling of heaviness and pressure. The apparatus also like intense sweating. So what are the 10 common signs of attack? That's what you can see in this picture here expressed diagrammatically. As I continue, then the patient crosses their chest, dyspnea, difficulty in breathing, shortness of breath, cyanosis, the patient turns blue, and the appearance of blue or the gray appearance of the skin. So indigestion or heartburn, then cold and clammy skin, weak and irregular pulse, a sense of anxiety or impending doom begins to arise in the patient. So what do you do? Now, the first thing you do is to call 911 for phone help. Then you loosen any clothing around the patient's neck, place them in a comfortable position, and you encourage them to rest. Activity uses oxygen which the heart does not have enough of during a heart attack. So you rest them. Then do not give the patient anything to eat or drink at that moment in time. Observe their breathing rate, and their pulse rate. So if trained to take vital signs, do so. Now, the patient stops breathing or is no longer having a pulse. You perform CPR if trained to do so. So stay with the patient until help arrives and inform the supervisor as soon as possible about the incident. And finally, you document the situation and all the steps you've taken to provide the care for the patient. So now we are moving to another uh, emergency situation like seizure. What is seizure? Seizure is a disorder in which there is an increased electrical activity of the brain, and in some type of seizures, the person has uncontrollable muscle movement. So we have tonic clonic seizures, and they have two phases, tonic and what clonic phase. So in this phase, the person's muscle contracts and spasm. Then in the clonic phase, the person have repeated muscle movements and their arms and legs and torso may jerk violently. I repeat, tonic clonic, that's the type. Then tonic itself means that uh, the muscle contracts and spasms, while in clonic, repeated muscle movements, sorry, their arms and their legs and their torso may also jerk violently. What are the signs of seizures? How do you know if patient is running into seizure or has seizure? That also depends on the type of seizure disorder the patient has. So as home health aide or personal care is, you may notice that the patient suddenly falls dropping from his bed or his standing position, without blinking, without blinking of the eyes, smacking of the lips, and was repeated swallowing. An example of seizure. So the person is not able to follow commands, inability to swallow, is drooling, repeated contraction and movement of the arms, legs, or torso, then making or shaking or jerking of the body. So what do you do? What do you do? If a patient has seizure and providing this information to the world, sorry, I was logged out a bit. I'm going to share my screen again so we continue from where we stopped. So still trying to share my screen and I was logged out again. So I'm going to share my screen. Sorry for the network issues. Network is really bad from our end. So I'm sharing the screen now. So we're talking about seizures. I'm talking about the tonic and the clonic seizures. I'm talking about the signs of seizures. I think we talked about the symptoms already. And we mentioned what to do if the person has seizures. So I will take it over. I will take it up from what to do. So if the patient has a seizure, it's important to obtain medical help immediately. You call 911 or any emergency services are available to be at your own disposal. Note the time that the seizure began. So this information will be provided to the 911 or the emergency services. Then you can place the patient in a comfortable position, keeping their head face up, and so that they can breathe. Then their head is a little bit tilted like this. Now, if this is something that you bend your head, breathing becomes harder when you tilt it up or straight it. So you make the head face up and straight. So as to aid what breathing. Then using any tight clothing, and if possible, place a pillow or blanket or towel under the patient's head to prevent what injury. Then you can clear the area of any possible hazards for which the patient could become injured. Never put anything including fingers in the patient's mouth during the seizure. If they begin to vomit, roll them on to the other side, the side. Never try to hold a patient down while they are having a seizure. Keep the area clear of objects and people. Do not give the patient fluid or food. And know the time when the seizure is over. Check for adequate breathing and pulse. If the person stops breathing or no longer has a pulse, perhaps CPR is trying to do so. And then you inform your supervisor as soon as possible about the incident. The next medical emergency we'll be looking at is cerebral. A cerebrovascular accident is known as stroke. Now, what is stroke? Stroke is also cerebrovascular accident. So there are two types mainly. Stroke is like a part of the body is paralyzed and is lost functioning to something that happens in the part of the brain. And I think that when less part of your brain is affected, it affects your right body side, and when the right side of the brain is affected, it affects your there. It's just like a chiasma, like this, goes like that. So it's either hemorrhagic or what? Ischemic. Ischemic in the sense that there's lack of blood supply due to a blood flow or a thrombus. But then it can be hemorrhagic in the sense that an artery has burst and so blood supply has been cut short. So in either ways, blood supply was cut short, either through a hemorrhage or through an embolus, so a thrombus. But remember the acronym FAST when assessing someone for possible stroke. Number one was facial down and they appear uneven. One of the parts of face that is affected will droop down. Then arm weakness, that's A. Arm weakness. Now, can the patient raise one arm or one side weak, or is it paralyzed? Then S for speech, because if the speech slurred or difficult to understand, and time is critical. If the home health aide or partner care is suspected possible stroke, we should call 911